Well, good afternoon. We've been through a lot over the last few weeks. Since this summer, we've been preparing for the second wave of COVID-19. And that preparation has paid off. 2 weeks ago, we unveiled the most extensive and the most robust COVID-19 fall preparedness plan in the entire country. We're investing $2.8 billion to hire more nurses and PSWs, reduce surgery backlogs, and deliver the largest flu shot campaign this province has ever seen. That plan also includes $1.37 billion to expand testing and contact tracing. That's $710 million to expand our lab capacity, another $360 million for assessment centers. And in 2 short weeks, we made leaps and bounds. Over 100 pharmacies in Ontario are now offering testing, with 50 more joining this week. More communities will be able to receive flu vaccinations and testing in locations including Oakville, Vaughan, Markham, Oshawa, Ajax, Whitby, Kingston, Belleville, Guelph, Peterborough, Windsor, Hamilton, Barrie, Kitchener, and Cambridge, and many more on the way. Wait times for tests are down. We've significantly reduced our testing backlog. We've limited the size of social gatherings across the province and put in place additional targeted measures in hotspots to help stop the spread of this virus. These efforts are starting to make a difference, but we can't let our guard down. We have 2,750 contact tracers and over 600 StatsCan interviewers currently in the field to help track, trace, and isolate cases. 25 local public health units are reaching 100% of cases within 24 hours, and that's amazing, and thank you. 30 are reaching 90% of cases or higher within 24 hours. And in 2 short weeks, we're well on our way to building up our surge capacity with reinforcements. We're hiring another 500 contact tracers and case managers by mid-November. We've hired 100 new contact tracers this week alone. We'll have almost 4,000 boots on the ground supporting our contact tracing efforts this fall. These new hires are being deployed to priority communities, including Ottawa and Toronto. 150 more staff are being deployed to help Ottawa. We'll be sending another 200 contact tracers to help Dr. Davila and her team in Toronto. The local medical officers and public health units have done an incredible work to identify the spread down to the neighborhood level, which is really incredible. My friends, together, we are making sure that there is nowhere this virus can hide. Thank you, and God bless the people of Ontario. Now I'll pass it to Minister Elliott.
Thank you, Premier, and good afternoon. Since the beginning of the COVID-19 outbreak in Ontario, our government has made protecting the health and well-being of Ontarians our top priority. One of the key lines of defence in protecting Ontarians is our case and contact management strategy. By quickly tracing and isolating cases and their contacts, we can prevent the spread of the virus. To support this, our government is hiring up to 600 additional contact tracers and case managers to investigate cases and identify and follow up with their contacts as part of our fall preparedness plan, Keeping Ontarians Safe. To expedite the onboarding of these additional staff and to support public health units, the government is partnering with Ian Martin, an Ontario-based recruitment firm that has extensive experience in supplying COVID-19 staffing resources to date. As the Premier mentioned, 100 new contact tracers have already been hired to assist public health units, and another 500 will be available by the middle of November. With another 600 recruits from Statistics Canada, this will bring the total number of case and contact management staff working to keep Ontarians safe close to 4,000 people. Each of these contact tracers can reach up to 20 contacts per day and help people navigate what to do if they've been exposed to the virus. That means these 600 new contact tracers hired in Ontario can make 12,000 calls per day. Ontario has also successfully implemented a centralized public health and case and contact management system in public health units across the province. This user-friendly system significantly reduces duplication, streamlines processes, and allows for more efficient case and contact management work to be completed. And once again, I do want to encourage all Ontarians to download the COVID Alert app to help support our contact tracing efforts. More than 4 million Canadians have already downloaded the COVID Alert app to date, and nearly 1,000 COVID-positive Ontarians have sent anonymous alerts to their close contacts. The more people who have the app, the more effective we will be at stopping the spread of COVID-19. And I want to remind everyone that the best way to protect one another is the same advice we've been following since this outbreak began. Maintain physical distancing, wash your hands thoroughly and regularly, wear a face covering when physical distancing is a challenge or is required, and stay home when you aren't feeling well, even with mild symptoms. By following this simple advice, we can protect one another and reduce the spread of COVID-19. Thank you.
Okay, we'll go to the phone line for questions. First question, please.
From Ashley Legasic at News Talk 1010. Please go ahead.
Hi, Ashley.
Premier, thanks for taking my question. We are hearing more and more about end-of-life accommodations not being made for family members. An incident over the weekend was echoed by several callers on our radio station, and it paints a picture of mixed messaging. So the doctor in charge of a dying patient said yes to having family members give their final goodbyes at the hospital bedside this weekend, but the nurse in charge said, no, you can't see your mom because you've traveled from a COVID-19 hotspot. It's a public health issue. So, Premier, have you now sent out a province-wide policy to doctors, nurses, and public health officials in situations like this to convey one clear, uniform message to grieving family members hoping to say goodbye to their loved ones in hospital? And what is that message?
Well, thanks for the question. And before I hand it over to Dr. Yaffe, one situation, there's probably many, and it's going to be full disclosure here, was Bill Carroll on 1010. He's a very close friend, him and Sylvie, and I talked to him numerous times over the weekend, and my heart breaks for him. My heart breaks for all families. You know, I can't imagine when my mom passed away in January, if I didn't have the opportunity to be beside her, be with your loved ones in their last hours or last days. And it comforts the people, even if they're sleeping or they're unconscious or whatever, they can hear you. And, you know, my heart just breaks for people. My heart breaks for Bill and Sylvie. It's terrible. And as I have an opportunity to talk to the table on that, probably Dr. Yaffe would probably be best to run through this. But I just want to tell everyone, I understand the pain that you're going through, and we'll do everything we can to make sure that you get in the hospitals. But this is, and I think Bill mentioned it on the air, this is the consequences. When I had a question from, I think someone in Ottawa, from the media in Ottawa, and said, you know, people think the media are exaggerating, politicians are exaggerating, but these are the consequences, real consequences, when people are running around not following the guidelines, not following the procedures. The consequences may not be your mother, it may not be your grandparents, but it's someone else's that has to go through the pain. And this is the reason we're up here every single day. Please just follow the guidelines, because God forbid it's one of your loved ones that are in the hospital and they have hours or days to live. That's you go down to root cause. And again, my prayers and thoughts are first Bill and Sylvie, with you and your family, and with everyone else, because it's not just Bill and Sylvie, and they'll be the first to admit it. I'm sure there's hundreds and hundreds of families that are facing this challenge. So we do need the protocol very clearly for the people to understand. I'll pass it over to Dr. Yaffe.
Thank you very much. That's obviously a very compassionate situation. And the policy should be that the visitors, the close visitors, are allowed to come in, obviously wearing appropriate masking and so on. It sounds like perhaps there was a communication problem within the hospital there, but I will follow up with Ontario Health later to get some communication out to all the hospitals in Ontario to remind them that in the situation when someone is dying and it's palliative, family members should be allowed to visit with proper precautions. Sorry for that situation.
Follow-up?
Thank you. And my next question, Premier, I'll turn back to you. It's about the TTC. Buses are completely packed. Passengers say few people are wearing masks. They're smushed together like sardines. The TTC says social distancing is no longer possible. So if a bus is full, you're just going to have to wait and get on the next one. That was their response to a frustrated passenger, I believe, over the weekend. So will the province step forward with funding and help for the TTC?
Well, on the policies, procedures, I'll hand it to Dr. Yaffe, but before I do, I just want to remind Toronto, and very frank, all the municipalities, and I appreciate all the Premier's support when we were negotiating with the federal government. But what I can say, I fought harder than anyone in this country to get proper funding for transit and for communities and for all 444 municipalities. And I can say that with confidence that I really went to town on the federal government, and I appreciate the support they gave us. And also, I just want to remind Toronto and the TTC, they ended up getting $400 million because of how hard we fought. So that's $400 million. And I understand. Matter of fact, I'll pass Dr. Yaffe. If I understand correctly, Dr. Yaffe takes public transit. I think you do. You were mentioning? No? Sometimes?
Sometimes.
Yeah.
Yes, I've certainly heard about that situation. I think obviously we need everyone who gets on public transit to be wearing a mask. That is required. And there needs to be, I guess, better education and enforcement around that. In addition, if somebody sees that the bus they're going to get on is extremely busy and full, they have to decide their risk tolerance. Obviously, if you're wearing a mask, you don't touch surfaces, you wash your hands really well, you are substantially reducing any risk. However, if you are if you are very concerned, don't get on the bus. I realize that may not be applicable or feasible for people. Think about also how long the trip is. If it's a very long trip, can you keep away from other people as much as possible? If it's a very short trip, it may not be as much of a concern, but I think it is extremely important that everyone wear a mask. Good hand hygiene. Obviously, don't go out if you're not feeling well, and keep in mind your own risk tolerance as you go about your daily activities.
Next question.
From Laura Stone at Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Premier. My first question is actually for Minister Elliott and perhaps Dr. Yaffe as well. It's about long-term care. I'm just wondering if the growing number of cases and outbreaks of long-term care is putting additional pressure on labs processing test results.
Well, we're still doing testing in long-term care homes, so there's some slight pressure, but we are being very vigilant in maintaining testing in long-term care homes, retirement homes, and other places of congregate living, because we know that those people are very vulnerable, and we want to make sure that they can be protected and kept safe.
Follow-up?
And Premier, I wanted to ask you, I know you were asked about this yesterday, but I wanted to follow up about that spinning studio in Hamilton. This is a pretty big story now because the studio says they followed all the rules and still there was an outbreak impacting potentially dozens and dozens of people. So is the province looking at maybe not regional closures, but high-risk settings such as gyms
Sector
or
closures,
fitness studios in other regions, and will you be looking at closing them?
Yeah, so that's more the sector, but it's really the public spread that we're worried about. But I'm sorry, I got to hand it to the expert, Dr. Yaffe will answer that. Thank you.
Yes, I'm very aware of the outbreak at Spinco in Hamilton. And when it first came to my attention and I was in discussion with the local medical officer of health and associate, I made recommendations that the public health measures team reconsider the guidelines for spin cycle places and other kinds of gyms, because that obviously, even though they followed guidelines, there was obviously significant transmission. So I think we do need to review the guidelines, and that's in process.
Next question.
From Randy Rath at CHDH TV. Please go ahead.
Hey, Randy.
Hi, Premier. I'm wondering about the flu vaccine. We're hearing that there's shortages of it, that it's not available in a lot of the pharmacies. A lot of the doctors' offices don't have it. It's leading to great frustration among people trying to get the flu shot, especially those that are in high-risk groups. What is going on with that?
Well, the Minister of Health would be the best answer. I know there's 5.1 million doses that we're handing out, a lot higher than any other time, but I'll pass it over to the Minister. Thank you.
Well, first of all, I'm very pleased to hear that there's so many people that want to receive the flu shot this year. It's really, really important as part of our Keeping Ontarians Safe plan. But there are no shortages. We started receiving shipments, and we are receiving scheduled shipments. We expect a large one to arrive tomorrow. But the first shipments went to hospitals, to long-term care homes and retirement homes, because we wanted to protect those individuals first, because they are vulnerable. But we are shipping as well to primary care physicians, nurse practitioners, and so on, as well as to pharmacies. So the supplies are coming in. We are not experiencing shortages. The supplies are going to be coming in. There is a good supply. I would ask that people either call ahead to schedule an appointment with their primary care practitioner, or call ahead to the pharmacy that they intend to go to receive the shot, just to make sure that they have supply right at the moment. But I know that many of the pharmacies are also scheduling appointments as well. But people should not be concerned about it. We do not have any shortages. Our regularly scheduled shipments are coming in well.
Follow up?
What is that schedule? When can people expect to be able to go to their pharmacy and not have a problem finding a flu shot?
I'm sorry, Randy, did you say when would people know?
Yes.
Well, the supplies come in on a regular basis, if not weekly, every 2 weeks. So they are coming in, but when they arrive at each individual pharmacy, I can't say whether you're going to have enough or not. Depends on how many people show up there and want to receive the vaccine. That's why I think, just to make sure that people save their time, that they call ahead just to make sure that there is a supply available to them. If it's not available tomorrow, it will be within the next few days, because, as I said, the shipments are coming in on a regular basis.
Next question.
From Travis Danraj at Global News. Please go ahead.
Hi, Travis.
Hi there, Premier. Premier Ford, this morning in an interview with Global News Radio in Winnipeg, Prime Minister Justin Trudeau seemed to blame the provinces for the lack of testing and contact tracing, saying that the federal government provided $19 billion to ramp up testing over the summer. If the PM says this funding and resources were available this summer, what was the holdup? And also, why is he making this announcement today when some jurisdictions seem to have given up on contact tracing?
Well, you must not be talking about Ontario, because we're kicking everyone's butt on testing. We're almost 4.5 million tests out there. We're working collaboratively with the federal government. I've been on the phone numerous times asking for more reagent with our Deputy Prime Minister. And you know what's amazing, Travis, is every hurdle all of us, I always include all of us, not the government, but all of us as Ontarians have faced, no matter if it's the PPE, no matter if it's long-term care, no matter what it is, going back to school. You know, we had a lot of naysayers. I get the naysayers, but put it into perspective. We have 4,800 schools. And there's 5 schools that had to close, and believe me, that's 5 too many. But again, we were able to get through that hurdle based on great teachers, great educators, great principals. These guys are champions. School boards are doing great. Kids are happy as anything, and I've talked to so many different kids, and parents are happy. But we got over the bump. When we had a backlog on the testing there, we were able to get through that hump. when we were being able to track and trace. We had that little backlog there. Now they've brought it right down. So with the support of everyone out there, be it companies or the people or the docs and the hospitals, we're able to get through the challenges. So, I'm not too sure who he's talking about, but I'm sure he wouldn't be talking about Ontario, because we're doing an incredible job. And not we. When I say we, again, I always want to emphasize the people of Ontario, the Matt Andersons of the world, his team, public health, the people, everyone understood. Now we have more pharmacies opening up. So maybe I'm going on a cough call, FMM call. I'll find out if he was mentioning us. I hope it wasn't us.
Follow-up?
Yeah, Premier, I know you spoke a little bit about gyms yesterday, but I've been getting a lot of emails from various business owners. Elaine Scott is the owner of Dwell Gym in downtown Toronto. She says that she spent thousands of dollars after gyms like hers were shut down months ago to buy things like plastic barriers, disinfectant, and implement other protocols. She has a direct question for you. Quote, as the owner of a 9,000 square foot gym with over 500 active members, we have not had a single case of COVID amongst our clientele. Please, Premier, explain to me the evidence behind gyms, not fitness facilities, group fitness facilities that is, being grouped with restaurants, and why I have to close my business again. Why not simply make masks mandatory in gyms and allow them to stay open?
Yeah, I'm going to hand this to Dr. Yaffe, but before, I think I told you the story about the two police officers that retired and opened up a small gym in South Etobicoke. And by the way, folks, I'm coming to pay you a visit outside the gym, obviously, and that's heartbreaking. When they put everything they have, they retire from serving the public for God knows how long, and putting their lives on the line every day. They put everything in a small business, and this is not just gym owners, but restaurants and other small entrepreneurs. And then they get closed down for 28 days. It's not anyone's particular fault, but that's what's heartbreaking. That's the issue. But I will always follow the advice of the health team, the scientists, the experts. As much as I could sit back, and it just pains me to see companies go through this, and we're throwing everything we can at them. And by the way, that $300 million that we put out there, it's not just for the areas, the hot spots. It's not just for Peel and Ottawa, for Toronto. It's for the entire province. If you've been hurt through this COVID and your business is struggling, then I would tap into that. But I'll pass that over to Dr. Yaffe.
People ask, show me which gyms have had an outbreak. Show me which restaurants in my area have had an outbreak. And the point is, there have been outbreaks in this type of facility, not necessarily in the specific one that they're asking about. So we're looking at places where they're indoor, where people are congregating. They may be wearing a mask. If they're exercising, probably not, but they're keeping space. But there's still evidence that that is the kind of facility where there can be and has been transmission. And so whenever we make these decisions, we have to consider, obviously, the risks and the benefits. And always there are people who say we should have closed them sooner, and there are people who say we shouldn't have closed them. So we're trying to get the best balance we can with respect to preventing the transmission of COVID-19, but yet minimize the economic impact. So it is a difficult situation for everyone. We recognize that, but it's not like I can say, well, just because your gym didn't have an outbreak, there's no problem. It's the type of setting and the way people interact that's the issue.
Next question.
Something back to this question. You know what's unfair? COVID's unfair. Look at all these people that have been hurt. It's just nasty, this virus. As I was discussing about the hospital, loved ones, Bill and Sylvie couldn't get in to see their loved ones. These poor business owners that are struggling, families that are struggling, people that have had COVID. This is just a crappy situation. Sorry for the language. Just a lousy situation. But we're going to get through it. We're going to win. We're going to fight this battle with everything we have. And in certain areas, we are winning. So, folks, let's stick together. We stick together. We've stuck together through this whole thing. We will come out the winners. I promise you that. We will beat this.
Next question.
From Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. I'm going to get a little bit technical, so this will probably end up going to Dr. Yaffe. I noticed today the percent positivity rate is up a fair amount, up to 3%. It was 2.6 yesterday, Dr. Williams told us. So, Dr. Yaffe, I'm wondering what you read into that, given that we were testing down lower and around the 30,000 range, and what this means about what's happening out there in the community.
Thanks. That's a good question, actually. The 7-day average percentage positivity is 2.2%, so even that is slightly going up. Today's percent, or the data from yesterday, 3% is worrisome. It may reflect that less tests were done. I think it was 32,000 tests or something like that, 31, 32. However, it also indicates that we see transmission in the community at this point, and that's no surprise, of course. So that's one of the things we're measuring every day is the percentage positivity. The percent in the pharmacy testing is very low, as you would expect, because only asymptomatic people who are not direct contacts are going to the pharmacies for testing, but even that percentage is starting to go up very slightly.
Follow-up?
When it gets to 3%, what is there anything different that needs to be done? And I'm looking also, when I'm thinking of this, at the higher numbers in York and Hamilton today. Are they getting closer to problem zones?
Well, the percent positivity is only one of the indicators we look at. It's one of the important ones, of course, but we look at the case rate per 100,000 population. We look at the effective reproductive number. We look at all sorts of other factors. So the public health measures team is meeting again later this week, and they will be considering the data for all the health units in Ontario and whether any changes need to be made for any of them. And of course, positivity rates would be part of that consideration.
Last question.
From Graham Richardson at CTV Ottawa. Please go ahead.
Hi, Graham.
Hi, Premier. We're working a story today about sewage and the research that's being done at CHEO. It's a bit of an uncomfortable conversation for some people, but there you have it. They are showing some very disturbing numbers in the sewage in Ottawa. 3 to 6 times more COVID than what we saw even a week ago. And the testing, of course, wouldn't reflect that because not everybody goes for a test. Mm-hmm. Do you think the public is fully aware of what places in the hotspots are facing or not?
You know something, before I pass it to Dr. Yaffe, I can tell you Ottawa, first of all, I love the people out in Ottawa. I have the best time when I go there. When I looked at the numbers on Ottawa today, they're the highest per capita in the province. They're 70 per 100,000, and that's high. So we have to all work together in Ottawa to reduce the numbers. And give you a comparison, I think Toronto's 57 out of 100,000, and Ottawa's 70, with a much smaller city, probably close to 1/3 the size of Toronto's. But I'll pass it over to Dr. Yaffe.
Well, I hope everybody's had lunch before this conversation, talking about sewage. But anyway, it is an important subject. Wastewater surveillance is actually one of the emerging methods of identifying an increase in COVID-19. And the research in other places has shown you can identify an increase in the sewage probably 2 to 4 days earlier than you start to see an increase in cases. So it's an alarm bell. At this point, it's being done sort of on a pilot basis in a select number of facilities across the province. And the data is shared with the Ottawa Public Health Unit and the relevant public health units. So they are aware of the data. And working closely with the study people. So that kind of data at this point is, again, it's on a research kind of pilot level, and it's a warning sign that they need to be looking for cases and doing more preventive measures. But as the Premier just said, we know Ottawa is a hot spot. This is confirming that it's a hot spot.
Philip?
And just on that subject, Premier, the medical officer for health in front of Dr. Etches in front of City Council just a few moments ago mentioned the fact that the capital came out early. We were in better shape than the rest of the province. We came out of stage 2 early. Mm-hmm. And I personally think the weather was unbelievably good in July. Yeah. Can you speak to that notion that people everywhere relaxed and started to act, I think, like there was no pandemic, and some people are still acting that way? How much of a factor do you think that was?
I think it plays a big factor. I think all of us let our guards down a little bit. You saw the cases go down. As you said, Ottawa was leading the charge, and overall we were seeing under 100 cases with over 14.5 million people. And then all of a sudden everyone, got a little lackadaisical. Now we're paying for it. And I think I've come up here 100 times and said it's going to bite us back in the butt if we don't tighten things up. So I just ask people, let's tighten it up, let's bring the numbers down, and that will resolve a lot of issues. I would like to pass it over to the Minister of Health. Thank you.
Well, I think it is fair to say that some people let down their guard a little bit too much, that we were seeing very good numbers throughout August and then into the very first part of September, and then we saw the numbers starting to go up significantly. So we really need to go back to those basic principles that we talk about every day, about physical distancing and wearing a face covering and washing hands thoroughly. All of those things are the most important things that each and any one of us can do to get those numbers down. So I would ask for all Ontarians' help in this. We're all in this together, all 14.5 million of us. So please help with this, and we'll be able to lower those numbers and get the hot spots out of being hot spots. Thank you.
Thank you, everyone.
That's great. Thank you, everyone.